In a healthcare setting, which of the following is the most appropriate way to handle an irate patient? So which of these steps would be best for a patient who's very angry? So option A says to directly confront the patient and explain why they are wrong. So the direct confrontation is something that's not a good idea. We should eliminate that. You don't want to go up and confront anyone. And then it says explain why they are wrong. If the patient's already very angry and then you go up and say, oh, you're wrong because of this, and this word wrong, that's probably going to anger them even more, and that's not going to help de-escalate the situation. So we should eliminate option A. Option B says ignore the patient's anger and proceed with the scheduled appointment. So it might be, you might think, okay, well, if you're ignoring the anger and you're just moving on with the appointment, that maybe that's just kind of hopefully it'll blow over kind of thing. But actually, if you ignore them when they're already very upset, it's going to be difficult to proceed with the appointment, and you probably won't make much progress. They're probably still going to be upset, and they might be more upset that whatever they're upset about isn't being addressed. So we should eliminate option B. There's really a better choice here. Option C says to empathize with the patient's frustration and actively listen to their concerns. And active listening is an approach that we use to try and mitigate situations and make the patient feel heard. And if you show some empathy, you show some understanding that you care about whatever is bothering them, that'll hopefully help them feel better, so then you can proceed with whatever they're here for their appointment. So option C looks good. Let's just take a look at option D. It says to offer the patient a sedative to calm them down. And no, that would be frustrating to the patient. Plus, as the medical assistant, we wouldn't be offering medications anyway. So we could eliminate that. And then that leaves us with option C, to empathize with the patient's frustration and actively listen to concerns.